Dr. Gregory Fox, American Academy of Pediatrics.
The AAP nationally absolutely supports school mandates for anything. Our goal as pediatricians is to get as many vaccines. I wish that there was more things that we could vaccinate against personally. 7704, which requires informed consent. We have objections to that on at least 2 counts, probably more.
If parents look up this information separate from their doctors, they'll find all sorts of crap.
My wife is a nurse. We're a pretty educated family.
If you go to Dr. Google, you're going to get all of the erroneous information on the vaccine controversies.
As a family, we have a lot of knowledge there, and I'm not an expert. I'm a normal guy.
The average parent is not going to be able to go to just Google.
I was vaccine injured as a child in the 70s more than once.
Anti-vaccination groups with a lot of stale, very inaccurate information.
I am the mother of a vaccine-injured child.
My daughter suffered a febrile seizure.
I don't think that we should only feel that doctors are capable of understanding the science. We, as the public, should too.
It should be pointed out that there is a lot of information on the internet that has gone stale.
Any peer-reviewed science is accessible to the public over the internet, so
Telling the truth about the vaccines.
If parents look up this information separate from their doctors, they'll find all sorts of crap.
You don't end up with a following of 150,000 people in a very short period of time with no experience doing this.
I find it to be highly dismissive. There's an assumption that I do not understand science and I have an inability to connect the dots. I find it to be very frustrating as well as an educated woman who knows how to read.
They need to read the research that many of us are reading now.
Actual science that is available to people who can read.
I've heard several witnesses who have testified that when they said no to vaccines, their pediatrician told them to go to another office. Could you please explain to them why that is?
If I have a child whose mother wants another week to read more up on the vaccine, if it's in February and they happen to catch one of those bad diseases, I can't help them. So
we do have stop signs in Rhode Island, and you are required to stop the stop sign. If you don't, you get a fine. Governmental interference of vaccines is very analogous.
I have found repeatedly that there is this paternalistic practice of, trust me, this is good for you, I know better than you.
trust me.
I let Greg Fox talk from the American Academy of Pediatrics tonight.
And so as a leader of the Rhode Island AAP, considered a national leader, I travel all over the country to conferences representing the Rhode Island AAP chapter. I will be the president come June. We represent over 300 pediatricians.
In our medical training, we actually do not get training on the science of vaccination. That is not part of medical training.
Oh, okay.
And that is not done in medical school or residency. And I would ask you to find a pediatrician who says they've been well educated in the science of vaccines. They aren't.
Thank you, sir.
That's why the CDC is our boss, because they've gone to infectious disease training and have gone through the whole process.
I've been studying vaccines for close to 17 years. Researchers were paid to find certain outcomes that the CDC wanted, and when the outcomes weren't obtained, they suppressed that data.
I'm a nurse. I was injured by the hepatitis B vaccine as a practicing nurse.
I have a molecular biology degree. I'm the lab director. I also have graduate coursework in molecular microbiology, and I'm a certified tissue banking specialist.
And we don't have to be dismissed as not knowing what reliable sources of information are, or that we don't know how to research on our own.
I've been studying vaccines for a long time, but particular since I've been in Rhode Island with the HPV, I'm noticing that there seems to be an utter lack of transparency.
The science is not settled. Anybody that says that to you, you need to run in the other direction.
To my right is Trish Washburn, chief of our immunization program, who can help answer any questions you may have. Written consent is which will threaten the health and safety of our community.
It's not settled, and it's being pushed on mass populations as though it is.
Vaccines have never been studied for carcinogenicity, for their effect on neuromotor deficit problems.
What's concerning me the most about what I'm hearing is that I think so many doctors already have an opinion and set mind about vaccines, and so they don't feel the need to explain informed consent or explain risk benefits, because in their mind, it's safe, and that's it. And so when we express our concern...
We're over the 2 minutes now, just...
Okay, I'm wrapping it up. So when we express our concern, we're not getting a real risk benefit. We're just getting, they're fine, they're safe, you'll be fine, don't you worry, I know better than you.
We cannot just listen and take what our doctors say with blind faith anymore.
First of all, gaining informed consent is quite a time-consuming process.
It gives you pause. It would make you think. And I don't think that's a bad thing as a parent, to take pause and think about what you're putting in your child. I wish I had taken that pause, and I didn't. And I live daily with that.
It's too much of a time-consuming process. Just logistically, it would make my day go a lot longer and maybe much more technically challenging, and kids would miss out on vaccines.
And there's absolutely nothing in this world that takes more time than taking care of a vaccine-injured child, taking care of a child that's having seizures every day, banging their head against the wall, a child that's in a wheelchair, a child that has permanent neurological damage. Nothing could take more time than that.
So when I counsel parents on vaccines, which I spend a good percentage of my day doing,
It's very time-consuming. We have 9 specialists. There are constant doctor's appointments. There is constant ill days. There is constant time out of work. This is all my husband and I do.
I also, like I say, I spend at least an hour of my day talking with families about vaccines. And if I need to spend a good chunk of that time, then these children will lose out on medical care.
As far as informed consent, I am a registered nurse. I work in a nursing home. I am in charge of 50 patients every day. I have an incredible load on me, but I would never, in any instance, if a patient or a patient's family came to me and wanted some explanation about something, would I ever turn them away? Would I ever not sit and take whatever time is needed to explain to them the risks and benefits of what we're doing?
It's too much of a time-consuming process. It will create gaps in vaccination care. And so for that one there, just logistically, it would make my day go a lot longer and maybe much more technically challenging. And
I'm horrified at the idea that anybody in the medical field would not take the time to do that. That's our job. That's what we're here for, to present our patients with a risk and a benefit of everything that we do.
trust me, I am asked to do so much more in terms of computer work and all sorts of different consents and surveys and everything that.
And with all due respect, doctor, I'm sorry to inconvenience you by the parents taking too much of your time, but these are our children, and these choices could have adverse consequences if you don't take the time to read the paperwork. I'm sorry that it inconveniences you, that you don't like it, but this is what the parents want for their children, and I believe
The parents are doing this every single day. People that I love, people that I care about. Parents, I don't even know how they're breathing every single day, how they continue this.
But that's the reality that we live in. Let's see.
As a practicing nurse, every single thing I was talking to my patients, every single procedure that they were undergoing, I'd explain it. There was informed consent. If the doctors didn't answer the questions, I answered the questions, because some of them were afraid to speak to the doctors.
I want to add one other thing, which is public record.
Physicians in 3 different states have reported that the HMO plans with which they contract do chart reviews and patient surveys at the end of every year. If their office scores high enough on these reviews of vaccine compliance, the HMO plan gives them a several $1,000 bonus to the doctor.
Trust me, I am asked to do so much more in terms of computer work and, you know, all sorts of different consents and surveys and everything that
I'm the parent of 3 children, and I am not corruptible. I don't have conflicts of interest regarding my children's health. Their health is my highest priority.
My doctor dismissed it as it had nothing to do with the vaccine she received. So, you know, there was no Facebook then, there was no groups then, I wasn't involved in anything then.
The doctor taking the report of injury, that was a listed side effect and happened right after the vaccine. The doctor treating the patient in a bullying and aggressive manner tried to tell us we were wrong about why that child was sick, and that how dare we say that that was from the vaccine, and we must be mistaken, and refused to take a report.
The proper way to get the information on vaccine information, on vaccines, their injuries, their potential, their benefits, is to talk to your doctor. That's why we go to medical school.
And in 2 of the cases where it was severe enough, I filed the report myself with the vaccine adverse reporting system because they didn't want to hear it. It was like, talk to the hand.
and statistically it's one of the safest vaccines based on the vaccine reporting system.
As a practicing nurse, I answered the questions because some of them were afraid to speak to the doctors.
I've heard several witnesses who have testified that when they said no to vaccines, their pediatrician told them to go to another office. Could you please explain to them why that is?
In my opinion, most children who come down with side effects from the flu vaccine get it from coming to their pediatrician and getting exposed in the waiting room, waiting for the vaccine.
Most children who come down with side effects from the flu vaccine
get it from coming to their pediatrician and getting exposed in the waiting room, waiting for the vaccine.
It's sickening to me that you're dismissed in a doctor's office because they don't have the time to explain stuff to you. They're not informed and they're just passed off and then told if you don't do this, then we cannot no longer see you here in this practice.
And so they're cooking the books, and whatever data a medical professional gives you is skewed by that deliberate exclusion of data.
It's too much of a time-consuming process.
And my search terms on Google were financial incentive to vaccines. If you Google that up, you'll find out you have to, like anything else, decide what's real and what's fake news, but we're all called to do that.
Thank you. Exemption, which in my eyes would completely undermine the work of thousands and thousands of medical experts over the last century and completely dismantle the progress that we've made in preventing diseases.
After the trial at Nuremberg after World War II, it became an internationally recognized human right, the right of informed consent. Informed consent is a human right. You cannot take that away from us. We'll be here fighting for it.
Once they turn 18, they say, I really wanted to get it, but I was afraid my mother was going to get mad at me.
So anyone offering testimony here, I'm going to ask you to ask them what their financial stake is. That's all I have to say. Thank you and God bless you.
Thank you. Thank you, Ian. Are there any questions for Ian? Thank you, Ann, for the blessing on Holy Week. We really appreciate it. Probably need it more than most people.